Today's short presentation, we're going to discuss different levels of anesthesia, surgery, and facility in relationship to setting up an office-based surgical suite. My name is Jeffrey Restuccio, and I'm a certified medical coder and consultant. Now, the issues are that today there are numerous surgical procedures that can now be safely performed in an office-based surgical suite instead of a facility. Many procedures take only about 10 minutes, and many lend themselves to a technique known as wallet, where the patient is under local anesthesia only, and that's a key issue. In orthopedics, there are at least 97 hand and wrist procedures that both lend themselves to an OBSS, to wallet, and they have a 0 SOSD. Now, what that means is that there's no additional reimbursement for your overhead, and that must be negotiated individually with each carrier. And the goal of my website is to help you with this, and all the information is free to use and share. My acronyms are explained in all of my slides, so I will allow you to read them if you're new. And we will proceed now to the different levels. Again, these are related. They're not exactly the same, but the lowest level of anesthesia does correlate with the lower levels of surgery and facilities, but they are separate concepts. So essentially you have 3 levels of anesthesia as outlined by the AAASF. You have 3 levels of surgery, and then there's 3 levels or 3 classes of facility, which are A, B, and C. Now, while the information below refers to ASCs, it also applies to OBSS guidelines. In general, a level 1 anesthesia level does not require accreditation, but there are definitely exceptions in certain states. So each state is different. So the American Association for the Accreditation of Ambulatory Surgery Facilities and Anesthesia level, now most OBSSs utilize level 1 or local anesthesia only, but that's critical in determining the level of regulation, your guidelines, and whether you get accredited or not. If you have some procedures that require a higher level, then you will be more likely to require accreditation in your state. So level 1 anesthesia, all procedures performed are under local or topical anesthesia. Level 2, basically the procedures are performed under intravenous or parenteral sedation, regional anesthesia. And then level 3 is basically general anesthesia. For the surgery levels, level 1 includes minor surgeries such as excision of skin lesions, moles, warts, cysts, lipomas, and repair of lacerations. Surgery limited to the skin and subcutaneous tissue performed under topical or local anesthesia. Now, most of these are considered minor surgery and have a 10-day global period. However, in our context, setting up the OBSS is for procedures that are considered major surgery and have a 90-day global and are most typically performed in an ASC. And according to Medicare, they're technically facility-only procedures. But some of them are very minor and take roughly 10 minutes or so. So level 2, surgery level. Again, these are more in-depth surgeries. Now, it does actually mention wallet here, which is kind of interesting. And again, this is where you get into what I call nuance, where the hand and wrist procedures, many of them are performed under warrant, but I don't know if I would necessarily consider them level 2 procedures. Now, when you look at the state guidelines, most of them refer to the anesthesia level, not specifically the surgery level. But again, this is something you need to be aware of. So in other words, you could have a state and they would say, if it's a level 2 surgery, then you need to be certified or, accredited. And again, this is where you get into issues because, you need to find out what level the different surgeries are, and you would have to find someone that was knowledgeable about those clinical issues. So one of the main things I'm helping you to do is generate the proper questions to ask. Sometimes knowing just the questions is half the battle. So level 3 surgery, now notice here, it associates it with the level of anesthesia, and these are surgeries that require general anesthesia. So that's pretty self-explanatory. And then again, your class A and B and C facilities. Now again, this may or may not relate to the issues. I don't think anyone specifically calls an OBSS a class A facility. Technically, it's not a facility. So once again, you have that terminology issue there. You really can't refer to it as a facility, but this is appropriate. Basically, topical, local, or regional anesthesia. The local is the main word here. Then class B facility. Again, it also relates to the anesthesia. And then class C, again, is like the others where it's the highest level and you would have general anesthesia. So again, most of your OBSS regulations are predicated on level of anesthesia. You have to read the fine print. You should always consult with a healthcare attorney when setting up your OBSS. Understand that you need to look at the mix of your codes that have what we call an SOSD. I have the information on the website. It's actually not difficult to find. However, there's just not very many consultants in the country that work with this issue because it would only come up under a very specific situation where you specifically want to do, for example, in-office endoscopic carpal tunnel. That would be a main issue, or any of the 97 other procedures that don't have reimbursement and you want to set up an OBSS. So, and 90% of the information on the internet does not address this issue. What happens is the doctors may set up the office surgery suite and then just discover way down the road that they're losing money and they're putting all kinds of expenses out that they're not getting reimbursed for, and they're not set up to negotiate. But some doctors are, so it's definitely something that you can be successful and you can implement an OBSS, but you need to know all the issues and all the different acronyms and all the different concepts involved. And anesthesia surgery facility levels is just important for you to know before you walk into your negotiations. My name is Jeff Restuccio, and my contact information is on the screen, and the website is IOECTR. Here's my hold harmless statement. Again, the coding and reimbursement information is provided for educational purposes only, and the author makes no representations and or warranties express or implied regarding the accuracy of the information contained in this presentation. And I thank you for your time.